Thank you for tuning into NorthPoint, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today, we are joined by Dr. Lavonne Moore. Dr. Moore has a doctorate in nursing practice, is a certified nurse midwife and women's health care nurse practitioner, and board certified lactation consultant. She practices at NorthPoint Health and Wellness Center and is CEO and founder of Chosen Vessels Midwifery Services and the Chocolate Milk Club, a culturally specific service of Chosen Vessels Midwifery Services that provides breastfeeding education and support for African American women. Her goal is to use the midwife model of care to inspire all women to breastfeed and support all those that do, because she believes that good health begins with breastfeeding. Thank you, Dr. Moore, for being here to answer our questions about maternal and child health.
Thank you for having me.
Absolutely. So let's just dive right into our questions. Our first question is, what does maternal and child health look like, and what does that include?
Well, it's a public health term to look at infant mortality, pregnancy, infant mortality, and maternal morbidity. It includes pregnancy and the postpartum period, as well as the newborn period for an infant. So it's kind of combining that dyad of a pregnant mom and bringing all of that together in one area.
And tell us, what does a healthy pregnancy look like?
Well, healthy pregnancy looks like a woman who has limited complications. Meaning there's no diabetes, there's no hypertension, there's no risk for preterm labor, preterm birth. That's what a healthy pregnancy looks like. A woman who has access to the right nutrition, is having minimal complications as it relates to pregnancy. And that means no chronic diseases as a part of that. Could be termed as a quote unquote healthy pregnancy.
Thank you. Let's talk about maternal mortality and what causes maternal deaths.
Well, still the number one cause of maternal death worldwide is postpartum hemorrhage as it relates to childbirth and the inability to prevent or stop excessive bleeding after delivery. So that's still the number one cause of maternal morbidity worldwide. So when we talk about maternal and child health, it's a big topic and it's a hot topic because of the issues of poor outcomes with women of color. So when you raise the question about what is a healthy pregnancy, that's kind of one of those terms that is kind of like, well, what is normal, right? So basically, we're just talking about pregnancy could even be considered a healthy pregnancy that has a good outcome. But we certainly want pregnancies that have less risk factors involved, because that moves you from having a normal physiological pregnancy and birth to having a high risk pregnancy and birth based on mother's pre-existing health conditions prior to, based on many of the social determinants of health that impact one's ability to maintain their health during a pregnancy or after.
Thank you. Let's talk about family planning and why that's important to maternal health. Can you kind of give us a definition of what family planning is?
Family planning is a term used to determine when you want to have children and how many children you want to have. So as it relates to maternal child health, it's often looked at negatively, but really what it implies is that women have control, or the ability to control how many kids they have, how many children they have, and when they have them, and to allow one's body to heal by adequately spacing children in between pregnancies, is important to maternal and child health. We know that pregnancies that are too close together does not allow the body to fully heal. And it takes about a full year for a woman to really heal from a pregnancy. And we talk about 6 weeks, we're really talking about involution of the uterus, the time it takes for the uterus to return to normal size. Because, you know, a uterus is on average about the size of a woman's fist. And it grows to, right, this large to hold a full infant or fetus. An infant after birth, fetus is what it's called in utero. So it takes about a full year for one's body to heal from that. So when you have children close spacely together, you have not fully recovered, and that can put you at risk for not having enough nutrients on board, you know, enough nutritional storage. It can also tire out a uterus so it doesn't clamp down as well and rather contract as well postpartum after delivery, that can lead to excessive bleeding or hemorrhage. So it's those kinds of things that can contribute to poor outcomes.
Okay, thank you. Talking about maternal health care, can you tell us generally what services are included in that?
Well, it depends on where you live and what you have access to. I mean, those who have access to services in our county, we're here in Hennepin County in Minneapolis, Minnesota. Things look very different than they do in other states. We try to wrap around services for those pregnant persons. There's a lot of resources available to them that may not be available in other states. So there is healthcare, of course. There's also social service support. At NorthPoint, we are certainly unique in the fact that we have so much available for those in our community who want to access it. We have iChirp, which is an empowerment support program for pregnant women. We have our food bank, right, that's available to those who may have some food scarcity issues. And our food bank provides milk, human milk now. We have a human milk bank available. That's an important part. And also we provide meat. Okay, not all food banks have access to meat. We know that meat is another form of protein that is important to maternal health. It helps to maintain blood pressures and blood sugars with good intake during pregnancy. So it's important to a healthy pregnancy. It's the building blocks that are important, those proteins and amino acids. We also know postpartum, good sources of protein are important for the quality and the richness of one's breast milk. So there's many benefits to what we provide at NorthPoint. We have our regular food, fresh fruit and vegetable program in the summer where you can access. And right now with prices being up and people, everyone's kind of feeling the pinch, right? Of the inflation right now at the pump and in the grocery store. Those things are really important to help fill in the gaps and decrease the risk of people not having what they need and contributing to poor maternal and child health.
Absolutely. So let's talk about public health in general. Why maternal and child health is a public health issue?
Because it impacts us all. And we know the cost to the healthcare system with poor birth outcomes. It's cheaper to provide support and services and resources to persons beforehand than to have a poor outcome and the cost of having infant in the NICU or something to that effect. We also know that people are at risk if they don't have access to adequate nutrition. And one of the things that we do also when we talk about child health in our county is that we make sure in the summer months when children do not have access to school lunches, that there are different facilities, including Hennepin County Hospital, who provide free lunch for children who are out of school during the summer. So it's these little things that fill in the gaps that are related to social determinants of health that are impactful on maternal and child health. And this is really a big topic, and I know you're kind of dabbing in at different angles of this, so I hope people understand that we're just kind of giving some generalities and overview, and that here in Minneapolis is really unique, I think, compared to when you talk to people from other states, what they have access to. We are not the norm, and so we really need to be grateful for the resources that we have here in this state.
Absolutely. Thank you.
Mm-hmm.
Um, let's talk about health factors related to pregnancy and childbirth, and then also infancy and early childhood. Can you tell us a little bit more about those?
Well, as it relates to pregnancy and childbirth, we're looking at things such as obesity, pre-existing diabetes or hypertension, or being pre-diabetic, which is often part of the whole cardiovascular spectrum. We talk about high blood pressure, diabetes, and obesity. They all kind of go under that cardiovascular umbrella, and that can all impact maternal child health. Also, women are having babies later in life.
Mm-hmm.
That is going to impact maternal child health. We know there's more potential for risk with having a baby later
Mm-hmm.
as well. We also, when it relates to child health, the things that we're seeing obesity as a public health issue in this country, right? And that
Mm-hmm.
certainly is an issue as it relates to child health, um, as well as the basics of having housing,
Mm-hmm.
having the ability to go to school, and having a safe home. A lot of our young people live in shelters. There's a lot of children going to the Minneapolis public schools who are coming from shelters. So
Mm-hmm.
housing and that being affordable is part of this public health issue around maternal and child health, as well as access to food, food security, and then also safety.
Mm-hmm.
When I think about a 3-year-old being shot
Mm-hmm.
last night. All of this is part of maternal and child health, and all of this is a
Right.
public health issue.
Absolutely. Thank you.
Hmm.
Um, are there any other health related factors maybe that you see more often than others that you want to highlight? Um,
As it relates to pregnancy, one of the things that we're seeing more of is
mhm,
pregnancy-induced hypertension, or
mhm,
PIH. We're seeing more of that, not just during pregnancy, but more in the postpartum period.
mhm,
So women not doing well after they're at home alone. We know that
mhm,
women after birth, there's very short stays. If they have a hospital birth, we're talking about
mhm.
24 to 48 hours. They may
Right.
stay for a normal vaginal delivery. They may stay 72 or more for C-section, and the
Mhm,
outcomes have shown, and we talk about why is this a big issue, is because we're seeing
mhm,
poor outcomes for women who
mhm.
are at home alone, and then they're developing problems after childbirth, and
Right.
increasing numbers than we've seen in the past.
Mhm.
Also, I just want to speak to the mental health as well.
Yeah.
Postpartum depression, having
Mhm.
resources for that available for women, and that being recognized sooner,
Yeah.
and people being connected with resources is another important issue in the community. I think that COVID has helped to decrease the stigma around mental
Yeah.
wellness or mental health, because it's something that we all deal with, and having access to services is really important. And that is also an important part of the maternal child health picture.
Absolutely. Thank you for that. Um, you've mentioned this social determinants of health. Can you tell us what the sociodemographic factors are in play during pregnancy, childbirth, infancy, those early years? What do you see?
Well, social determinants of health reflects where we work, live, and play, right?
Mhm,
Okay. So, where you live, having access to safe housing is going to impact your pregnancy. We know that chronic stress for all of us increases our cortisol levels that lead to inflammation in the body, and that leads to disease, they're beginning to
mhm,
understand. So, not having a safe place to live, being somewhere where there is gun violence or hearing gunshots, as those in North Minneapolis can attest to, is stressful,
mhm,
and makes one feel unsafe. So that can impact your health. The other thing is having access to public transportation
mhm,
to get to and from work, and having gainful employment that allows you to provide for your family. And all of those things contribute to one's health.
Right.
We also begin to understand that women with the same socioeconomic factors, especially women of color as non-women of color, still have poor health outcomes in terms of pregnancy outcomes compared to those of that. If you compare them apples to apples to oranges,
Right.
if you compare white women, for example, to Black women with the same socioeconomic status, Black women still have poor birth outcomes. And we're finding that the issue of race, right? Racism in that whole construct contributes also to that health. We know microaggressions, right, that occur for people of color are contribute to our stress, and that
Right.
contributes to that rise in cortisol levels that increase inflammation, and we're now connecting that to heart disease and diabetes
Right.
and some of those other factors.
Yeah, absolutely.
Yeah. So there's things
And
we can control and things we can't.
right,
But
right.
what we can control, we certainly want to support people in doing so.
Absolutely. And honestly, that was my next question about race and ethnicity. How do those factor into those disparities in, and maybe real quick, you can give us the definition between mortality and morbidity, and then if you can speak more to this idea of disparities in race and ethnicity.
Well, when they talk about maternal morbidity, they're talking about maternal death.
Mm-hmm.
Mortality, they're usually relating that to infant death. So it's the
Okay.
mothers, the birthing persons, death
Mm-hmm.
rates versus also those death rates of infants. And
Okay.
I'm not going to go into, as I talked to you about, I'm not an epidemiologist, but the
Mm-hmm.
one thing that I do want to state about that data and how it's often aggregated, they're
Mm-hmm.
important to understand that you can't compare or group everyone together if you
Mm-hmm.
truly want the full story. So
Right.
historically, the data was grouped as Blacks, and that Blacks meant everyone, African Americans, non-Indigenous
Mm-hmm.
Black folks to this country. And we
Mm-hmm.
understand that those stories are different. You can't group
Mm-hmm.
African immigrants with African Americans and get the right story.
Sure.
So I think one of the things that's important is that our health department, our local health department specifically, is beginning to pull that data out separately. And I think that's important to really get the picture of what our breastfeeding rates look like, what our maternal morbidity and infant mortality rates look like, and the things that contribute to them, right? So
Mm-hmm.
that we can get a more accurate, fuller picture.
Absolutely. Thank you.
So when we talk about ethnicity and how this
Mhm.
relates,
Mhm.
one of the things that we've seen in the news over the last year or so is as Black women saying no one's listening to us, people aren't hearing
Mhm.
us, and that there has been some high celebrity, almost
Mhm.
fetal losses, and many other
Yeah.
women who have lost their lives in the process of childbirth and feeling that part of the factors that contribute is not being listened to or not being heard.
Mhm.
And so, how do we change the way in which women feel safe to have birth? I think how
Mhm.
the historical lens is an important part to mention here because,
Mhm.
because we've changed the way that we birth, that has impacted our outcomes. We know
Mhm.
historically, especially for African American women who have really been the focus of all of this conversation because of the increasing death rates,
Mhm.
is that who you birth with is important. Historically, we didn't have access to the traditional healthcare systems. We birthed at home, we birthed with midwives, we breastfed our
Mhm.
babies. So one of the things in terms of just talking about the data is to talk also about those solutions. And so where it's
Yeah.
important to reclaim some of those practices to get back
Mhm.
to improving those outcomes, because traditionally midwives had really good outcomes and we served
Mhm.
our community. But when things changed in how we practice medicine and women had access to care in a different way and really felt that um, um, the care that white women had was better than the care
Mhm.
that they had, and then they switched how they received their care, who received their care, in thinking that they were getting better care, right? when in
Right.
fact that may have not always been the case. It affected our birth outcomes. It affected
Mhm.
also us feeling cared for. And I
Sure.
think, us being cared for is is a big issue. And I don't know how to articulate shifting that within our system in a way that, besides educating our providers and staff on how to be more sensitive to the needs of the diverse populations that they serve. And it can be a challenge. We have a lot of demands
Mhm.
as providers, and COVID has certainly, for nurses and doctors, shown the demand of the work in itself and how difficult that can be. And so we need ways to support our providers
Mhm.
so that we can support our patients in a better way. And I think some of that will stem multi-directional. We need to educate in those institutions of training how to
Mhm.
better care for folks, and do some additional things in terms of teaching patients how to advocate for themselves as well, and having those resources available for them to help them to do that within our systems.
Absolutely. Thank you. And you spoke to this and how we do things at NorthPoint, and I just want to share the information here on the screen. Um, but NorthPoint is a place that you can come to for maternal and child health. And you spoke to it earlier in the interview,
Yeah.
but I'll let you kind of let people know what's available.
There's lots of services. We have midwives and physicians at NorthPoint for maternal child healthcare. We have pediatricians, nurse practitioner pediatricians, as well as physicians. We do a lot of individualized care. We're lucky to have behavioral health services in the building that provides mental
Yeah.
health services as a part of that maternal child health connection. And we also have child, or rather adolescent behavioral health services that are
Mhm.
available as well. We all know that we have pharmacy, radiology, and dental. We know that dental health is important to one's cardiovascular health. So that's a big piece. We're kind of a one-stop shop in many ways. We have iChirp, which is part of our service that we would consider to be our ink side. And we also
Mhm.
have parenting services for dads on the side over there in the ink
Mhm.
side. There's a lot of those social service support pieces that are available for those who come in to NorthPoint. We have
Mhm.
Mama Tutu, which is a culturally specific mental health service
Right.
support group for pregnant women. So we have a lot of things available. We have lactation consultants in the building. We have
Mhm.
lactation rooms where staff as well as patients can go to breastfeed. Ooh, what else do we have? We provide
Mhm.
family planning services. We have
Right.
family planning service. If you don't have insurance, we have resources to cover the cost of those. We provide in-clinic vasectomies. I'm sure a lot of people don't know
Oh,
that we
okay.
provide vasectomies in clinic for
Mhm.
men as well, in our family planning services. We also have physicians who do circumcision for our newborns. We
Mhm.
have functional medicine physician, also who's a lactation consultant, and one of our pediatricians, Dr. Carrie Needrud, also, and Michelle Haggerty. They're both
Mhm.
physicians who are lactation consultants as well as myself. So we have a lot of services. We have OB care coordination, so we can connect you with someone who can help support and navigate you through your pregnancy and connect you to the resources that you need internally as well as in the community. So lots going on at NorthPoint. And so
Yeah.
please contact us if you're pregnant and need support. We provide prenatal care for those who deliver at Hennepin
Mhm.
County Medical Center, as well as we provide support to those who deliver at North Memorial Robbinsdale location. Our providers don't go there, but you can still come to us for prenatal care. We have a relationship with them. Okay?
Wonderful. Wonderful.
Yes.
Thank you.
Thank
Well,
you.
thank you so much for answering our questions, Dr. Lavonne Moore. We've been talking about maternal and child health. And yeah, thank you for your time.
Thank you. Have a good day.
Thanks. You too. Thank you for listening to NorthPoint, Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about NorthPoint or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms. We know the times get hard, and we're here to help at NorthPoint. When you're feeling low.
And I think you sort of spoke to some of these solutions, but maybe if you had to highlight some solutions that maybe you champion or that you believe in, sort of what gives you hope about these numbers that are truly shocking in their disparities?
Well, one of the things you said about what I champion, my introduction, I think, provides some insight into what I champion. I really believe that good health starts with breastfeeding. So one of the things is reclaiming those cultural practices. We know that people who breastfeed, especially African Americans, it decreases their risk factors for cardiovascular health disease. That includes diabetes, obesity, and hypertension as adults from being breastfed as infants. So it pays forward. So we know there's many benefits for breastfeeding that touches many of these social determinants of health. That includes economics, general health factors, and all cost, clean environment, right? Less, it's more green, and so it's environmentally cleaner to breastfeed. So I think one of the things is reclaiming some of those cultural practices is part of the solution. And I know that's a hot topic right now during this formula shortage, but just because we support breastfeeding does not mean that we are against bottle feeding. We also want women who formula feed their children to feed their children correctly, and we want to support them in doing so. But we also just want to let people know the purpose of breastfeeding, the benefits of breastfeeding, and really the purpose for our breast is to breastfeed, because we, hypersexualize breasts in our society so much that it's just important to understand that the benefits of breastfeeding, and that we want to support those who do and help those. Many women understand how important it is to breastfeed. We've lost even breastfeeding as a cultural norm. So people don't know the benefits of breastfeeding. They don't understand the harmfulness of formula. They don't have models in the community that they can see breastfeeding to make it a normal kind of thing. So it's not a pro or a con. We want children to be fed. They all need to be fed any way they need to be fed, because there's some babies that need formula, and we support that. But we still know the importance of breastfeeding, and we are just really wanting to make sure that people understand how valuable it is, and that's a practice that is important to reclaim to improve health outcomes. The other thing is who we have. Midwives are still a part of this picture. We've had a lot of conversations about doulas, and doulas are birth assistants or trained birth support, really, for the mother. And they take that piece of the midwife support role. And we're happy to have them to support women during pregnancy and childbirth, but we want to make sure that the conversation about the importance of midwifery care does not get lost, because midwives have historically been a major part of the healthcare continuum to families. And from a cultural perspective, in African American community, they were providers for the entire family. It was just not about the birth in itself. And we want people to know that midwives, who they are, because a lot of times people confuse midwives with doulas. That is misnomer. Midwives there's a variety of pathways into midwifery, from CNM to CM, CPM. CNMs are master prepared midwives with nursing backgrounds that provide care for the mother and the child, and are responsible for the pregnancy and the delivery, not just that one part of support during the labor process in itself. So they're higher trained and they're providing care for normal physiological births. We need our physicians. We're not saying we don't need our physicians. We certainly do for those high-risk women, but there are many women who can birth safely with the midwife, and bringing them back into the conversation of care and the continuum of care is part of also the solution.
Any other solutions you want to highlight?
The other things that I think are also important is to continue the dialogue and to continue to create creative models. You know, a lot of times we focus on what we have, and we already kind of know that we don't have what's adequate. So new ideals and looking outside of the box to provide a continuum of care, to provide comprehensive care that wraps around and is collaborative, I think is really important. To involve teams of care providers with teams of community members to help support families and to help create families that can advocate for themselves is going to be really a big part of the solution, because historically that's not the way we've always done stuff. So,
right. Thank you.